I met actually Doctors Goldman and Klatz in 2003 because I was so intrigued by the activities of the American Academy of Anti-Aging Medicine. And so we started our journey from there, and they asked me to speak at several conferences, and from there it progressed on to, fortuitously, me starting up an aesthetics business here in Dubai. And that was way back. Actually, I had already started the aesthetics business, and eventually they asked me to become their director outside the USA to teach the aesthetics course. And we've been teaching this course since 2011. We've had several batches of students. We teach several modules to deal with all aspects of aesthetic medicine. There is such a great interest now in aesthetic medicine from specialists from all different fields of medicine, from dentists to gynecologists to dermatologists, of course, and plastic surgeons, who are considered the core. But in many instances, even dermatologists in their residency program do not touch upon aesthetics. So at the end of the day, they have to learn the skills the same way as any other medical practitioner. And therefore, Module 4 is a great introduction because it introduces, it involves the injectables, Botox and fillers. We do an intensive training, we give a little bit of theoretical overview of the subjects, and then each participant has the opportunity to do some hands-on injection. We have a model for almost each participant, and it gives them a real insight into how injectables can modify facial features, facial contours, embellish a young face, or even restore the face of an aging individual. Well, you know, Module 5 starts off with basic laser physics, because at the end of the day, when physicians want to adopt a specific technology, they will eventually have to learn the nuances of that particular system. But when we learn about the basics of lasers, then they have better skills to be able to select the right devices for their clinic. And we've had feedback from several participants that it's the first time that they really understand how a laser works. So I think this core fundamental knowledge is important. And then again, being able to use the devices to see how they work is a great benefit to many of them. In Module 6, we introduced the participants to minimally invasive techniques such as a laser liposuction, which is a rather surgical technique, but at the same time they also have an insight into non-surgical methods to treat localized adiposities. There's little pockets of fat, for example, double chin or a little bit of a pouching belly or saddlebags, through injectables and through devices such as selective and focused ultrasound, radio frequency, and also a lot of skin tightening devices like near-infrared light and again radio frequency. So all of these techniques can be used in combination or in isolation, depending very much upon the case. Well, if nothing else, aesthetic practitioners want to see how other people do it. And since we are affiliated with the clinics in Dubai, several clinics in Dubai, they have an insight as to how we do things. We all like to see and to gain from other people's experiences. And in this way, I think they're all very pleased in that it does provide that for them. And we also love the interaction with our participants, and we always pick up little tricks and tips from them.